Okay, I think well, I think we'll make a start. So I can see we've got quite a few people joined us already, and it is increasing, but we'll make a start. So first of all, just wanted to thank everybody that's taken the time to first of all register their details and obviously join us for today. We are going to be covering, as it says there, our how lateral flow testing can help protect your employees and also obviously support your business remain operational. We've got a packed schedule, as you can see, so we're going to start in a second. I'll introduce you to our panel today and give you a quick overview of who Hampton Knight are and kind of the journey we've taken and a bit of context around how we've got to kind of COVID testing. I'm then going to pass on to Dr. Gareth Williams, who's going to cover sort of the testing types, overview of all the different types that are available. Some of the key considerations that you need to make when you are introducing a testing process. Joe's then going to cover some of the operational considerations as well, some of the key things to think about when you are developing and designing your testing regime. Very pleased to have Brian with us today. I'll introduce him properly in a second, who's going to bring all that to life and give us a case study of how it's been working for him and his business, Lend-Lease. And then we're just going to finish off with a summary of kind of the services that we've delivered and an overview of our COVID service. And then finally, we're going to have a Q&A just to allow any questions you may have. So for those of you that are signed in, there is a section at the bottom on your screen, which is a Q&A. So if you have any questions as you're listening through or have any general questions, if you put that in there, we've got a team in the background that are going to be recording those. So we are going to try and cover as many as we can on this webinar, but if we do run out of time, we will get back to you separately and answer all your questions and queries from there. So if you do have any burning questions, then fire away and we'll cover those off. So without further ado, so my name is 𝗁𝗂𝗍𝗃. I'm the Client Services Director at Hampton Knight. We're joined by Dr. Gareth Williams. He's the Medical Director for Medigold Health. We've also got Joanne Hughes, who's Operations Director for Hampton Knight and has been integral in the development of our COVID service. And then, as I said, we're very pleased to welcome Brian van Kampenhout to the panel today. He's very kindly given up his time to join us and kind of go through a bit of a case study about how Hampton Knight and Lend-Lease have worked together with the COVID testing service. So for those of you that have not come across Hampton Knight before, just kind of give you a bit of background and a bit of context. So Hampton Knight were established about 21 years ago now. Our core focus, and our core focus still, is obviously drug and alcohol testing within the workplace. And we've, I suppose, developed some sort of really core sort of structure and services, which when we started delivering COVID testing, it allowed us to kind of pivot very quickly. So to give an example, we've got, or we built up over the last sort of 20 years, a very strong collection network, which is based across the UK, which allows us to visit sort of workplaces and those kind of things to do drug and alcohol testing. So we were able to use that same kind of logistics and infrastructure to pivot very quickly to do the COVID side as well. As you can see there, in 2017, we joined the Medigold Health family, which gave us a lot of benefits in terms of the clinical side, the clinical governance and support, as well as the structure being within a bigger business. And from a point of view of COVID testing, that again helped us to kind of mix our experience delivering drug and alcohol testing with the clinical expertise and clinical governance that we have from the Medigold Health side. So when COVID did hit, obviously it's completely unprecedented. You know, nobody was expecting it, but we were able to kind of pivot very quickly, develop services that are able to support some of our sort of, you know, core clients at the time, but also companies that have never used us before for anything else, being able to deliver COVID testing for them as well, across both PCR and the lateral flow side, which we'll cover a bit more detail. We've now got a dedicated COVID team that can help with everything from general queries, questions, help with setting up programs, but also delivering the services as well. So that kind of takes us a bit of a journey from alcohol and drugs right through to the COVID service as it stands at the moment. So we're going to go straight into the information now, and I'm going to hand over to Gareth, who's going to take you on the next few slides.
Thank you, Mike. I just want to quickly recap where we are with testing and how we've got now to the stage where the majority of what the testing that we're offering and doing is lateral flow device. A few of you may have attended our previous webinar a month or so ago when at that time the majority of what we were offering was PCR testing. I'll talk a little bit later in a couple of slides time about the different types of testing and explain those to you. But essentially we're now moving on from what was the PCR test, which is a throat swab test, much the same as the lateral flow device, but that swab had to be sent to the lab, which resulted in quite a bit of delay, taking about 48 hours to get a result back. The government subsequently wanted, and there's a considerable cost element to that PCR lab testing service. The government have then decided that they were going to roll out community testing involving the use of lateral flow devices. And with that, they've made available all the lateral flow devices. If people can remember that Liverpool was one of the first places this was, I say, trialled out on and researched in, and the government were very encouraged with the outcomes from that in helping reduce the numbers in the community that were testing positive for COVID. So subsequently, government have been encouraging employers to undertake workplace testing. As an organisation, Medigold Health / Hampton Knight have been providing testing to clients for a number of months now. And like I say, initially that was PCR testing, and we've now pivoted to more offering support and training and advice on introducing lateral flow devices into organisations. The purpose of the lateral flow devices is to identify cases who probably are they are asymptomatic cases either in the community or in the workplace, to stop those individuals spreading the virus in the workplace and therefore providing a safer workplace and reassuring employers and employees alike that safe working practices are in place and the risk of acquiring COVID from working is being minimised. It's suggested about 1 in 3 people who do have COVID don't have any symptoms at all. So it's be quite easy for people unwittingly and unknowingly going into work with COVID because they haven't got any symptoms, and then spreading it to others who may develop severe symptoms of COVID. Clearly people don't intentionally want to spread it, but with 1 in 3 people being unaware they've got COVID because they've got no symptoms, it does cause a particular issue. The lateral flow device is a little bit like a pregnancy test kit device. It's a very fast, simple way to test people who don't have symptoms of COVID. One of the important things is if people in work or your employees do have symptoms, this is not the test for them. They should be following the NHS testing process and attending the local NHS test service for a PCR swab test. The reason for that is to some degree the PCR test is more accurate, but also it will identify the variants. The lateral flow test will just tell you you've got a positive test. It doesn't tell you the variant or anything like that. So if somebody in your work is presenting with symptoms, the lateral flow device isn't a test for them. But having said that, the lateral flow test device is very easy, practical to use. It works very quickly, and it can be used in a wide range of settings, as I'll describe later. The other point to make is a decision that you as an employer will have to make as to whether this is a voluntary process or whether it's mandatory. It is mandatory in healthcare settings, such as the NHS and care homes, but that's a decision that you will need to make as an employer. I'm going to do my Chris Whitty bit now and ask Nicole, next slide, please. So I'll talk just very quickly about the antigen PCR swab test. As I described, that was one of the early testing processes that's been used. It's described as the gold standard test. It detects current infection, and it is extremely accurate. Having said that, no test is 100% foolproof. There are false positives and there are false negatives, but it is the gold standard test. It has to be carried out by healthcare professional by diagnostic purposes, meaning that it has to be sent off to a lab, a Ucas accredited laboratory, for them to look at the swab, and that then takes time. So between doing the test, sending off to the lab and getting the result back, it can often take 48 hours. That obviously has implications in the workplace, meaning that the person who's had the test, because they're usually symptomatic, will have to stay off work until they get the result. The main reason that the PCR swab test is now used is for travel purposes, and you will also have seen it in various industries, you know, the Premier League for football, for example, and also we have broadcasting clients that still use the PCR for their bubble groups. Next slide, please. So I'm going to spend a bit more time talking today about the rapid antigen lateral flow device. This detects somebody who is currently infectious, but probably hasn't got symptoms at all. It's, as that picture shows, it's similar in the outcome in a pregnancy test, in that essentially you drop a sample, take a swab, put that into a buffer solution. The buffer solution is then mixed up with a swab, and some of that solution is dropped into a part of the test kit, and then that will give you a result in 20 or so minutes. These don't need to be sent to the lab. They can be carried out on site, so they're far more flexible and more readily available than the antigen PCR test. They're also, as I said, very quick. And also they're far cheaper than sending samples off to labs. There has been some concerns about the accuracy of these tests, but there was some criticism of some of the testing done in Liverpool and things like that, but research has now shown that they are very accurate in picking up those who are infectious, particularly if you've got a high viral load. That means lots of virus in your body and potentially spreading it. It will tend to pick those up. Having said that, it does mean that it does miss a few people, but those numbers are relatively low. By carrying out repeat testing, the chances of the test being accurate increases. The important thing as far as this group is concerned is that the lateral flow device kit must be CE marked. And the government are providing, they do have a list of approved kits that have been approved by the MHRA, Medical Devices Authority. So that's that. As I've described, with the lateral flow device kit, they are cheaper than the PCR kit. You get results a lot quicker, and it's easier to do these in larger numbers compared to the PCR device. There is also the antibody lateral flow device that some people may have heard about in the early days of this, when people thought that they would be a way of getting the economy going and things like that. But unfortunately, research has shown that, or there's a lack of research essentially as to the validity of the antibody finger prick blood tests and those devices. We don't really understand enough about the immunity to COVID at the moment, but I'm sure in time that will develop. So it's important we keep up to speed with looking at what testing regimes and test kits are out there and the developments in that, which Joe and the team themselves are constantly doing. Next slide, please. Like I've described, the lateral flow test kit is fast, relatively simple way to test people and the important thing is they don't have symptoms, but they may still be spreading the virus. I'd reinforce the fact that lateral flow test devices aren't a solution in isolation. You still need to maintain safe COVID work practices, thinking of you sort of washing your hands, face masks, and the 2 meter space as is normal practices. The fact that you've had a negative test, lateral flow device, doesn't mean that you can carry on living life like we did 15 months or so ago. Still means you need to follow the government guidance and PHE guidance on safe working practices. Those who test positive must immediately self-isolate to passing the virus on to others. So once you've got the lateral flow device, a positive result, they need to go home and they need to isolate for 10 days. I will describe later that all results, whether they're positive or negative, do need to report it to PHE, and PHE should be in touch with those who have positive tests for track and trace purposes. As I've described there, Public Health England and Oxford University have shown that these tests are reliable, but they do perform better when there's relatively higher levels of the virus in the individual. Next slide, please. Now, some of you may be aware of terminology like sensitivity and specificity of tests. I don't want to confuse too many people or even confuse myself by going too much into depth about sensitivity and specificity. But essentially it relates to how accurate a test is. And sensitivity refers to the proportion of people with COVID-19 who have a positive test who have actually got a positive result. In other words, they've got, the test itself is positive and they are a true positive. It is recognized that when a person has a low level of virus in their system, for example, in the early stages of the infection, then the lateral flow test does tend to be somewhat less sensitive than PCR tests. I've already described PCR tests are mainly used for people with symptoms, but the lateral flow device is recognized and it will detect the majority of cases when levels of virus are at their highest and people are at their most infectious. Lateral flow testing is useful to find out if a person is infectious at a particular point in time. It doesn't necessarily mean that they won't be infectious in 4 or 5 days' time or in a week's time. It is not an all or nothing test that they're fine. And if they have had a COVID, outside the infectious window, the lateral flow test will not produce a false positive, meaning that once they stop being infectious, they will stop producing a positive test. Next slide, please. As I've described, there's been quite a bit of research into the lateral flow devices by Public Health England, Port and Dan, University of Oxford as well, on the rapid antigen test. And as I described up in Liverpool, they did quite a bit of research there, which suggested there's very high specificity, meaning that the positive test has a high likelihood of the person being a true positive. The sensitivity does alter a little bit upon how and who does the testing, as in if you're carrying out the testing yourself or if it's a non-healthcare professional initially doing the testing, that it does seem to affect the accuracy a little bit. But it does, if you keep repeating the test, then it does improve the accuracy. As I've described, you can get false reassurance that you've got a negative test, but if you keep doing the testing in the workplace, then you will be able to identify those who have got COVID and get them to self-isolate and stop the spread of COVID in its track in the workplace. Next slide, please. Some people unfortunately don't quite carry out the test properly, meaning that they end up with a void result. There are clear instructions on the packaging and our team are very aware of how to do these tests. Having said that, you will occasionally get what is called a void result. With a lateral flow device, it's quite straightforward to just repeat the test and retest the person as soon as possible. I've described already that every result has to be reported back to the Public Health England, that is whether they're positive or negative. I believe it's slightly different up in Scotland, where the Health Improvement Scotland, I think, run this programme, and they only want to be notified about positive results. Just a word of caution about data protection issues. Test results are considered to be sensitive personal details and sensitive data, and you should ensure that you do have systems and processes in to take into account GDPR issues. That, to some degree, is where we can help and support people, making sure that they've got their systems and processes in place and that they are following those guidances. It is important that employers as well communicate with their staff, keep staff informed about potential confirmed COVID cases. Having said that, you've got to respect confidentiality. The advice from 𝗶𝗫 is that you shouldn't name individuals, and you shouldn't be sharing anybody's test results without their consent. I must admit, I find it's a little bit difficult in a workplace when you've just sent somebody home because after just having had a COVID test. So there are some difficulties there, which I appreciate. But the IC Information Commission Officer is quite clear that data protection laws does not prevent an employer ensuring the health and safety of their staff in general. So it is reasonable for them to say, that there has been a case, and therefore that that information can be shared, and then they will need to consider sort of close contact identification and things like that, which 𝗶𝗫 will involve track and trace with the individual concerned. Next slide, please. Just to give you a very brief, quick overview of where lateral flow devices have been used. NHS and care settings have been doing this for a number of months now. I am aware that within the NHS, staff are doing it twice a week on a regular basis at set times and have to produce evidence to their employer of the results of their tests. Schools and colleges, we've been supporting a number of schools recently on their return to work. Locally where I live, I know that a number of schools have been doing testing, and a couple of the local senior schools have carried out thousands of tests over the last week, 10 days or so, to help them get back into school. Sports and hospitality, as I've mentioned already, the Premier League, I know the rugby and the cricket have been doing testing, mainly PCR testing, but I can see that moving forward, sports and hospitality sectors may want to consider things like lateral flow device testing to help open up. Travel, there are some specifics about travel, and there's lots of controversy at the moment about travel passports and where does testing fit in with that. Again, most of that is PCR related testing and timing of testings, and the requirements for different countries vary from one place to another depending upon the local situation. And obviously what we're more concentrating on today is offices and workplaces and supporting them with lateral flow devices. I'm sure Joe will mention the logistics and support that we have been providing, and the types of organisation we've been doing that for. Next slide, please. I think that nicely moves on to introducing Joe, I think.
Yeah, thank you, Gareth. That was really useful. So yeah, just from my side, just to go through some key operational considerations. So if you've got to that point where you feel introducing proactive testing is the right thing for your business, then it can be quite overwhelming, the next steps. There's quite a lot of information to work through. There's quite a lot of considerations that you need to make. So really just wanted to pull out the key things for you to be aware of today. So facilities, again, I would say it's not just a case of providing a room and that's it. We need to make sure that that room is fit for purpose. Is it big enough? Is there ventilation? Is there a one-way system that you can introduce? With our clients, obviously, we go through a risk assessment review process, and we'll give feedback and advice, if we don't think the facilities are quite right. But essentially, you are setting up a mini test site at your location, at your site. So we just need to make sure it's as secure as it can be. I was actually at one of the Lend-Lease projects earlier this week in Birmingham, and their facilities are fantastic. What they've set up is really, really good. However, what they found is that where their test site is located, it's in the training facility. So it's quite some distance away from where the workers are working. So what they're looking to do now is relocate the testing facility so it's more central. And again, what they're hoping is that will encourage more footfall, more uptake of the testing, because it's not such an inconvenience to sort of go an extra 5 or 10 minutes walk to get their test done. So again, these are the things that you just need to take into consideration from a facilities point of view. Staffing and training, I suppose these two will really depend on the type of testing that you're looking to do. If you are looking to procure the government testing kits, which a lot of businesses are, that's been obviously now opened up to all businesses. But what you need to consider then is, I suppose, are you looking to do everything? So procure the testing kits, do the training, and then actually man the testing facility itself. We do a little bit of mix and match. So again, we're supporting a number of clients where they've procured the testing kits, but will use us for training and support of their staff. We sort of provide like supervisors that can go on and work alongside their team to give sort of hands-on support. And then we've got clients that will use the testing kits from the government, but then we'll use our technicians to go on site and use those kits. And I suppose the benefit of that then is you don't have to worry about so much of the clinical governance, the audits, the training, etc. And we still actually have quite a number of clients that are using us to provide the kits, so actually haven't gone down the route of using the government kits. So again, quite a few things to consider. I think from a staffing point of view as well, when the test is operating, so if we're on site today at a test location, it's having sort of some points of contact within the business from your side to work with our team, potentially making sure that everything flows, the people are coming through, things are being adhered to, etc. So again, these are the sorts of things that we talk through during the implementation process. I just wanted to mention, I know Gareth touched on it as well, but just around the employee communication. So we've definitely noticed that where clients don't allocate time or resources to communication, that the footfall and the uptake of testing can be quite low. Naturally, people can be a little bit suspicious. So if it's not explained really, really clearly what the testing's for, what will happen with their results, what happens if they're positive, people have been quite concerned if they do test positive, will that affect their earnings? Will they have to kind of self-isolate and not get paid for that time? But also, through to like what to expect, like how does it actually work when you come for your testing? People, again, it's not the nicest of tests to have. We can't get away from that. So again, just making sure that you're planning some time for communication, engagement, and that really should continue on throughout the program, really. In terms of frequency and duration of testing, so as a minimum, once a week really should be what you're aiming for. It's not really, the lateral flow devices isn't really intended as a one-off test. There's sort of little point really just to do a test on a Monday and then think that's kind of like the end of it. I think if you're committing to it, then again, a lot of our clients are looking for 6-week testing programs on a weekly basis. And then that kind of gives it a real good sort of chunk of time to settle in, look at the results, look at everything that's kind of coming back through from that testing. So again, these are sort of the things that you need to consider. And then again, quite a lot of different sort of practical considerations, depending on which method you look to use. We will kind of, help sort of guide you through everything that you need to introduce. But just, practical considerations, like if you do get a positive result, have you got processes in place for that person to be retrieved from their workstation, sort of, sent home safely, able to do sort of deep cleaning within that work area. Also, workplace bubbles. So we get a lot of questions coming through where maybe one person's tested positive, but the person that they're working next to is negative. So, what do we do in those sorts of circumstances, and what should the next steps be? And then reporting again, so reporting to Public Health England, again, just all of these different elements that just need to be taken into account through those implementation stages. We tend to find sort of, about a week to 2 week lead-in time is good. It's not something that you can sort of, just pick up the phone and sort of think we can get this sort of rolled out in the next day or so. It does need a bit of consideration and time to plan it in. And that leads me quite nicely actually into the next section, which is Brian from Lend-Lease, who has been through all of this and is going to talk to us now just about how Lend-Lease have rolled out their rapid flow testing and what impact that's had on their business.
Thanks, Joanne. Good afternoon, everybody. Thanks for the opportunity to be able to speak to you this afternoon. So I'm Brian Van Kempenhout, head of EHS for Lend-Lease Europe, and I want to take you through a bit of the experience of lateral flow testing in the workplace. So if you just indulge me first, I'll tell you a little bit about Lend-Lease. So we are a leading international property and infrastructure group. We were founded in 1958 in Sydney, where we're headquartered with about 13,000 people working globally in Australia, Asia, Europe, and the Americas. Our core capabilities are around investment management, development as a client, and construction. And in Europe, we're not self-perform. We operate with a supply chain that deliver the construction projects for us. We are committed to creating places that leave a positive legacy with a focus on the health and safety and well-being of all stakeholders. We're keen on innovation and we like to drive the sustainability agenda. In Europe, our construction sites are spread over Manchester, Birmingham, Leicester, and London. We have around 50 to 800 people on each of those projects. Can I have the next slide, please? So why lateral flow device testing? So if we just give you a little bit of background. So as we all know and remember it well, we went into lockdown in March of 20 and all of our construction projects as well went into lockdown, and we paused for about a 4-week period while we prepared our sites to be COVID secure. And we brought them back in mid-April. And those people on our construction sites, we've got about 800 people in the construction business, but we had a sort of a core of 200 people that had gone back, and they've worked right through the pandemic. Now, we've been pretty pleased with the response we've got from our people around how they've supported all the COVID secure measures, and as such, we've had limited outbreaks on projects. But nothing that we'd be, we had the odd case. But then in the middle of December, one of our projects, a large urbanisation project in London, we've got about 800 people working on there. They experienced an outbreak of COVID, and we had circa 60 people impacted out of the 800. And it was a mixture of those that actually were confirmed positive with COVID through PCR testing, and those that were then pinged by track and trace. So clearly that gave us a lot of cause for concern, and we decided that the best decision was to close that project early for Christmas, get in and clean, and then try to understand what the problem had been. Turns out that was a variant of concern. It was the South African or Kent strain, whichever one you want to refer to it as. But that's how we got impacted on that project. Now, at the time, we were starting to discuss having advanced discussions around what we're going to do about lateral flow device testing, because we were trying to follow the science. The government was talking about a 5-day relaxation over the Christmas period. Again, give us an increased concern about when we come back in the new year, how many people are going to be actually infected and are then going to be communicating the virus around the project. So it seemed like a good plan that we start looking at testing. The problem is where do you go when you want to start testing nationally on scale that we wanted to do with circa 4,500 people on your projects every day? Fortunately, I'd worked with Hampton Knight in the previous employment, so I reached out to Richard Baines and Joanne, who helped me develop and others, I've got to say, it wasn't myself on my own, others in the business, and we worked up a testing program and actually commenced testing in February. But from speaking to our own workforce, this is Lend-Lease, when we talked to them about testing, they were keen that we did do the testing because it gave them the confidence. They were having to leave home every day to come in to work and then go home. So anything that would give them confidence that they didn't have the virus, or if they did, then they could take necessary action, was a positive. So we decided that it wasn't right just to do Lend-Lease. We needed to do the whole workforce for it to be effective. In terms of business continuity, that was vitally important to us. We needed to keep operational continuity across the business, delivering on the projects. At the end of the day, we're in business to make money. We've got shareholders, so it was important that we kept the projects moving as well. Then, of course, there's protecting the brand. Some of our projects, we're delivering apartments and homes for people, and like you and me, if I'd planned on moving in a particular date, then I want to move in on that date. So we owed it to those people as well as our external clients and some of the government projects we're working on that we finished on the date that we said we were going to finish on. Next slide, please. So in terms of operational challenges, I've got to say there was a few here. We were, I guess, Hampton Knight and Lend-Lease, we were both flying blind. Nobody had done it at this sort of scale before. So we sort of took a conscious decision that we'd start slow, and what we would do, we'd just test Lend-Lease people in the first week, is what we did, and we had pretty good uptake from our own people. And then we introduced the supply chain in week 2, really, of the testing program. And it was really quite disappointing, the low uptake we got from the workforce. And as Joanne said, we thought we'd done a decent job of communicating what we were about and why we were doing it, but we still had this low uptake. And perhaps I'll leave that to a bullet point later, just to explain why that might have been. So in terms of collaboration with Hampton Knight and Lend-Lease, it was really positive. We worked together. It took a lot of time and effort. We had a lot of scheduled meetings, and we had lots of unscheduled meetings as well, because there was plenty of bumps in the road that we needed to work through to get the testing program in place. But it would be remiss of me not to mention that we do have differing priorities, and you must remember that as a construction business, we're always working to a deadline and the pressure's on the program, whereas Hampton Knight is much more about clinical assurance, and quite rightly as well. But those different priorities are a little bit of a problem. So, as I mentioned, we've got about 4,500 people working on our sites every day. And if you're doing 35 tests per technician per day, that's an awful lot of technicians, and that's not going to work. So fortunately, we were able to work together to increase those numbers, and we saw an improvement on it, albeit, as I say, we didn't get the response that we were hoping from the supply chain. In terms of the site teams, they're constantly under pressure to meet programme. COVID's all that's done is made the problem worse. They've got increased pressures, and then we introduce a testing programme for them as well that they have to manage. We can do what we can for them centrally, but at the end of the day, they're the ones on site that's going to manage that testing programme. That we found was very difficult for them. And like I say, we did what we could for them. But I'll give you an example. We've got 2 sites in London, both very similar, about 300 people on each of the projects. Site A didn't have anybody managing the process, and they got 14 tests in a day with a technician. And then Site B had 2 technicians and got 140 people through in a testing in a single day. So it stands to reason that that you do need to manage the process. The sites need to dedicate somebody to manage that process. So this has probably explained to you some of the reasons why we didn't get a good uptake from the supply chain. When you consider the financial capital versus the human capital, a lot of the workforce in construction are agency labour, so they're not directly employed. So it's how do we encourage them to take up testing when they know if they're positive that they'll have to go and isolate for 10 days? How do they earn money then as well, when you consider that a lot of them are hand to mouth as well? So that gives you sort of a bit of an insight into why they might not want to be tested. So what we've done, we've worked with our supply chain managing directors, asked them to support the process and communicate the need for them to join in the testing programme. Now, of course, we know that there's the government scheme available, £500, if you have to self-isolate. But, you know, the question is how easy and how quick can you access the money? And that's the equation these guys and girls are working with when you talk about testing. The technician's attitude has been really key for us to being successful on the projects where we are seeing great success, and they've become almost part of the team. So they, as Joe knows, the guys and girls on our project ask them for them by name now. They want the same ones back because they get the consistency through those technicians. But again, one of the things I would say is the technicians don't quite understand how construction sites operate, and they need the consistency of the same day of turning up. And we did have an experience where technicians were turning up not on the agreed day, and sites can't switch that quickly. So again, anybody planning on testing, you know, need to be very clear. Testing is on a particular day in the week that you want to do. We have taken on now the government Innova testing scheme that's been introduced across projects. That's helping us with commercial exposure. I won't talk too much about that. But in terms of the aim of our testing was around, we want to test the whole workforce once per week. So if we're looking at a school report, how have we done? So to date, by the end of week 6, which was last Friday, Hampton Knight have conducted a little over 4,600 lateral flow device tests of a possible 27,000 tests, 25k positives. So in terms of removing asymptomatic people out of the system, that's been a great success. We've removed them, which is good, and that's what we were looking to do. Next slide, please. So where next for testing with 𝗀𝗃? So from the many discussions we've had on testing, where we sit as an organisation, we'd like testing now, the government to switch it and do testing from home. We found it too disruptive in the workplace. It's very difficult, and I'm not alone in that as well. So we, Construction Leadership Council and all the parties that are members of that have been discussing it, and lots of people would prefer that we went towards home testing. Despite me saying that, we are continuing to plan further Innova government testing, and we anticipate delivery of our next batch of Innova test kits that will keep us going sufficient to the end of June. We also have adjusted our strategy slightly as well. So where projects are co-located with a government test site, we're encouraging them to go and use those test sites as well. So thank you very much for your time.
Thanks very much, Brian. First of all, just wanted to say, well, thank you to Brian and also to Gareth and Joe. That information presented was really, really good, very informative, covered a lot of ground, and I've been monitoring the questions that have come in, so it's sparked a lot of debate and questions as well, which is great. So what I'm just going to finish on very quickly is just a quick summary, and then we'll dive straight into the questions, and we'll try and cover as many as we can do. So as it says there, we've covered over 40,000 COVID tests now since we started back last year. That covers everything. I know we've had a few questions around sort of different delivery models. So that does include on-site, doorstep sort of tests where people are at home, as well as clinic locations as well. The next point there is key because, I mean, as Brian's pointed out, every company or every organisation has very different requirements, very different kind of needs as a business, whether that's shift patterns, locations, size of employee numbers, those kind of things. And I think our approach has always been to work with you to make sure that, you know, whatever the requirements are, we try and work out the best solution going forward. And obviously sometimes, especially with COVID, because it's such an unknown, is that there are going to be things that crop up that we need to address and obviously work with our clients to improve on. As mentioned at the start, we do have a dedicated team that work 24/7. So you know, a lot of our clients like construction, manufacturing have 24-hour operations which we can meet, which not only means the actual delivery of the service, but then also the reporting, which I think for some companies where they have an international presence and they have travellers, is also key to get those results back. And then also the key thing is to see how effective the service has been. So how many people we've tested, we can break it down by site or location, and then also what the outcomes have been, sort of positive, negatives, and those kind of things. And then the final point just to raise is that we are currently going through Ucas Accreditation. Again, there's been a few questions about sort of the government lists of devices and accreditation. So we can share those with you so you can see that we're on there and currently going through that process. So we'll move on to the questions. One of the ones that has cropped up a couple of times, and just to confirm very quickly, is that we will be, or we have been recording, thankfully, just checked, and we will be sharing this webinar to everybody that's registered. So you will have a copy of the video, the link to the video that will be on YouTube, and also a copy of the slides. So if you do either miss anything or want to check any information, it'll all be there. Let's dive into it. Like I said, we've had a really good response. So I'm just going to cover probably one of the most popular ones that we've had, is around the kind of 90-day period. We've had a few questions where people have asked that if somebody has tested positive for COVID, there is talk about a 90-day period when they shouldn't be tested. So I don't know, Gareth, do you want to elaborate on just that kind of sort of process and the guidance?
Yeah, I'll try and answer that. Essentially, if somebody's had COVID or positive test for COVID, whether that's a lateral flow device or the PCR test, or they've ended up in hospital, the current guidance based on NHS guidance and their activity and what they advise and do is there's no point in repeating that test upon somebody's return to work for 90 days. The difficulty is that you may well still continue to have some fragments of the virus in your system, and that will produce a positive test potentially for up to 90 days. So although there is viral fragments there, that doesn't mean the person's infectious as such. It's quite safe for them to return to work once they're feeling better and for example, if they haven't got persistent cough and temperature settled and all that, they can get back to work. But there is little point in doing further testing on those individuals for a period of 90 days, the research has shown. I think that's the explanation.
Excellent. Thanks, Gareth. Another sort of key question is around the vaccination. So as the government has promised and is obviously delivering on wide-scale vaccination programs is if they have employees that have got or had the vaccine, whether it's the first jab or they've had both, what is the kind of suggestion or the guidance around them? Should they now be exempt from testing, or should they still be included in any testing program?
My understanding is that they should still carry on being tested. There's still a lot being understood about the vaccine and its efficacy. How you know, there will still be a few people that will not build up the immunity as a result of the vaccine, but those numbers are relatively small, it is thought. But the advice is, even if you've had 1 or 2 of the doses of the vaccine, you still, should take part in this testing program. There is still a potential for very small numbers granted, but the advice is they should still carry on being tested.
Excellent. So one more kind of operational, maybe one for yourself, Joe. So there's a client that's asked around, they've got kind of remote mobile workforce. I know this is something we've done for quite a few clients where they've got home-based people that are traveling, or they're not, they're not allowed to site until they've had a test. So did you want to talk about our kind of capabilities around sort of remote testing from home, or testing people on their, what we class as a doorstep, but I think we're allowed in. Yeah, just talk around that kind of service.
Yeah, so I suppose if you've got people based from home and might need a test for travel purposes, I think was the question. So yeah, we do offer, we call it doorstep testing. It's actually home testing because we do actually go into the house to conduct the testing, obviously in full PPE, etc. And then the PCR test is completed, sent to the lab, and then obviously travel certificate will follow sort of 24 to 48 hours thereafter. In terms of capability for lateral flow testing, we've had a little bit of experience with clients that have tried to mirror that process for home workers. But to be honest, most of the lateral flow device testing is carried out at mass on a workplace basis. But again, we do have the capacity and capability to do sort of one-off tests if required. But then you would question why you needed to do just one lateral flow test, and the reason for that to be undertaken. I suppose the other thing, we do have our mobile screening units across the UK, again, which have been quite beneficial for some of our clients where they want, to do the testing at site, but haven't got the facilities to set up a test station. So again, that's an option for consideration as well.
Excellent, thank you. There's been a series of questions that kind of cover the same topic, because I know that there's been a shift in the last few weeks from, I suppose, the test being administered, which, around a technician delivering taking the sample, through to the government kits and other sort of advice around people administering it themselves. And like I said, there's been probably about 5 or 6 questions now, all around the same sort of topic about what is the difference, what is the accuracy difference between somebody doing it themselves to somebody, a technician or a healthcare professional collecting the sample.
I'll start with this one, Joe, if I may. I think the main difference is in the accuracy of the outcome of the results. There's certainly evidence to show that if it's a healthcare professional doing the testing, you will tend to have a greater sensitivity, and the results are more likely to be accurate. I think that's the reason historically why the government recommended that this was only undertaken by healthcare professionals. I think with the volumes and numbers of tests now needed, it'll be impossible for every test to be carried out by healthcare professionals. And I think initially now the advice is, if somebody who has been trained in supervising, carrying out the testing, supervise the first 2 or 3 tests on individuals, and then individuals then are able to know what they should be doing and be able to carry it out on themselves. I know, for example, lots of schools have been doing lateral flow testing and initially being supervised, and then later on sending test kits home with the pupils for them to test at home. I know that is going on to some degree, but it all boils down to accuracy of the test at the end of the day.
Yeah, absolutely.
Yeah, I think it's as well, just to add, what we found is that where we are using the kits, the government kits that can be used for self-testing, is actually a lot of the people are still preferring us to conduct the test for them. I think people just know that they don't collect. It's a difficult test to do to yourself, and I don't, we're finding that people still prefer us to do that. And also just in terms of, I suppose, the resources, as I mentioned in my slide, if you are looking to allocate people to do that testing part of the process within your own workforce, it's then, I suppose, looking at the bigger impact in your operations and then sort of backfilling those people because they're not doing their day job, and these are the sort of the considerations that need to be taken into account.
Mm-hmm. Yeah, absolutely, and I think a lot of companies are looking at that, aren't they, in terms of being able to dedicate, because I think the guidance is around dedicating 3 people or 4 people to a testing area and being able to have that resource available. So excellent.
Yeah.
So I'm just conscious of time. We've got a couple of minutes left, so I'm going to try and get maybe a couple of questions in. This one is more, and we've had a couple actually, two of the same, which is kind of really about the reporting of results side of things. So this one particular question talks about the responsibilities. So if a company is doing their own testing, so not the government kits, but they're doing their own testing, do they still have to report the results to 𝗵𝗁?
Yeah, simply yes, they do. Although if they're not using the government kits, then as we know, with the approved kits that are out on the market at the moment, they should only be administered by healthcare professionals anyway. But yes, essentially all testing that's conducted has to be reported to 𝗵𝗁.
Mm-hmm. Excellent. There's another, I suppose it's more about the consent side of things, so it's probably a bit of a detailed question, but is there any sort of quick response around, because it is a voluntary test, so if somebody does refuse to take the test, is there anything an employer can do around that from either a safety perspective or anything along those lines?
I personally, I think it depends upon what industry sector people are working in. I think you can make an argument if people work in the healthcare sector that they are potentially a risk not only to themselves, their colleagues say, but also to patients they may be treating. So you can make a health and safety argument, if you like, for mandating testing in the healthcare sector. I think at the end of the day, I think it's a management decision as to whether they make it mandatory or not. I think it's a bit more difficult if you can't demonstrate the risks to others. I think it's a tricky balancing act and a decision for the employer at the end of the day, I think.
Yeah, no, absolutely. So I've ended on a tricky one, but we've reached 1 o'clock. Just to kind of wrap up, there is still quite a lot of questions that we haven't covered, but we will get back to everybody. There's quite a lot of operational questions as well, which we will cover off and get back to everybody that's asked a question. So first of all, thanks very much to everybody that's joined and listened. And again, thanks very much for the panel that have been amazing, some really good information and insights. So thank you very much.